Hi, I'm Neil O'Grady. I'm an osteopath and I'm just going to show you how to do bony landmarking of the knee joint so that you know where to find the different landmarks when you're treating it, and specifically as well if you're going to do mobilizations and manipulations on it. So where I would start is on the joint line, so my thumbs on either side of the patella tendon here, like that, in the joint where the meniscus are, and my index fingers in around the popliteal area like that, at the tibial plateau on the back of the knee, or in the back of the knee. That's my where I'm starting, and then from there I will move distally and medially onto the medial tibial plateau here like that. I'll come medially and about 45 degrees down here, and what you have here, you can't see here, is the posancerine area where the posancerine tendon for your sartorius gracilis and your semitendinosus will attach. This here, where this screw is here, is your tibial tuberosity. That's the bump here on the tibia. An area where you'll have issues with the kind of young adolescents who are sporty, which would be Osgood-Schlatter syndrome, where the skeleton is growing very fast. They're very active, and the muscle and tendon is pulling on the bone, and it starts to spit out more bone and calcify, and you get this bump on it, sometimes permanent. It can be painful. Then from there we can head back up to the medial condyle of the femur here like that. We can jump up onto the medial epicondyle, and you notice here the medial collateral ligament is here. You see that's very wide and thick as compared to the lateral collateral, and it's also in a lot of cases is an attachment to the medial meniscus, so those two injuries can be co-related, that's the word. And then if you jump back here, you've got a little pointy bit here called the adductor tubercle. Actually, the only adductor muscle that attaches to it is the adductor magnus, so that's here. The condyles at the back you can't really get to in the popliteal area. We then come back down to our starting point here, so we're our reference point either side of the patella, and we go to the lateral side. So we jump down onto the lateral tibial plateau here and come down a little further onto this lateral tubercle here, like lateral tibial tubercle, otherwise known as Gerdy's tubercle. This is actually an attachment point for your iliotibial band. I can jump up onto the lateral femoral condyle, and I can go onto the lateral femoral epicondyle, which leads us onto the lateral collateral ligament. And if I jump down here, I'm on the fibular head, so the tib-fib joint often can be a dysfunctional joint, and you've got some of your nerves where your sciatic nerve splits. You've got your fibular nerve here, the deep and superficial run around here can cause dysfunction. So that dysfunction there can cause irritation to those nerves on occasion. If I want to look, obviously we've got our patella here like that, and if we just flex the knee fully, so we can get the patient to hang their knee off the edge of the table, I just pull this away for a moment so we can see. We notice that it's higher here and more prominent on the lateral aspect than the medial aspect. We can guess that that's to prevent lateral patella dislocation, which happens sometimes, and it exposes it when you flex it. So that, everybody, is